Hello, and welcome to the Medicare 101 presentation brought to you by the Area Agency on Aging 1B's Medicare Medicaid Assistance Program. Today, we will cover who MAP is, what MAP does, and Medicare. Let's start with MAP, Inc. MAP, which is Michigan's Medicare Medicaid Assistance Program, is comprised of unbiased counselors located across Michigan and offering free health benefits through counseling assistance. Our MAP counselors are certified and have been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company and they are not licensed to sell insurance. In many states, MAP is called the SHIP program. That's the State Health Insurance Program. A MAP counselor can help you understand new healthcare options, understand Medicare and Medicaid, compare or enroll in Medicare prescription drug coverage, review Medicare supplemental insurance needs, understand Medicare health plans, apply for Medicaid or a Medicare savings program, and of course, they can help you identify and report Medicare and Medicaid fraud and scams. Let's take a look at Medicare. What is Medicare? Medicare is health insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease. It is administered through the Centers for Medicare and Medicaid Services, and enrollment takes place through Social Security for most, and through the Railroad Retirement Board for railroad retirees. Medicare has well-defined benefits and exclusions. It does not cover dental, vision, or hearing except under special circumstances. It does not cover long-term custodial care, and it places limits on certain care items such as physical therapy, durable medical equipment, and more. It also does not cover over-the-counter medications. Medicare works with private insurance companies to provide to you Part D prescription coverage, supplemental plans to help fill in the gaps in original Medicare, and Advantage plans, which combine parts of original Medicare, usually with prescription coverage, and often some dental, hearing, and vision coverage. If someone's already receiving Social Security benefits, they will automatically be enrolled into Medicare Part A and Part B without an additional application. They will receive an initial enrollment period package, which includes their Medicare card and other information about 3 months before turning 65, or 3 months before the 25th month of disability benefits. If someone is not getting Social Security or Railroad Retirement Board benefits, they will need to sign up for Part A, even if they're eligible to get it premium-free. They should contact Social Security 3 months before turning 65, and if they work for the railroad, they need to contact the Railroad Retirement Board to sign up. While Medicare is administered through the Centers for Medicare and Medicaid Services, Social Security is responsible for enrolling most people in Medicare. The Railroad Retirement Board is responsible for enrolling railroad retirees into Medicare. This is an example of the original Medicare ID card. It is red, white, and blue, and it is used when a beneficiary gets health care. The Medicare ID card shows the Medicare coverage, Part A for hospital, and Part B for medical, along with the date that that coverage begins. The Medicare ID card also shows your Medicare claim number, which is unique to just you, comprised of numbers and letters. If you choose another Medicare health plan, your plan may give you a card to use when you get healthcare services and supplies. You should contact Social Security or the Railroad Retirement Board if you receive railroad retirement benefits, if any information on this card is incorrect. And if you don't want Part B, follow the directions and return the card. Medicare has 4 parts. Part A, hospital insurance. Part B, medical insurance. Part C, often referred to as Medicare Advantage. These are plans that are HMOs and PPOs. And Part D, Medicare prescription drug coverage. When you first enroll in Medicare and during certain times of the year, you can choose how to get your Medicare coverage. There are 2 main ways to get your Medicare coverage. First is through Original Medicare. This includes Parts A and B. You can add a separate Part D prescription drug plan and also add a Medigap policy, which is the Medicare Supplemental Insurance. These policies help pay your out-of-pocket costs to Original Medicare. The second way to get your Medicare coverage is through a Medicare Advantage plan. Again, Medicare Advantage is referred to as Part C. These plans are like an HMO or a PPO, and they typically include Part A, Part B, and Part D all into one plan. Medicare Part A and Part B are part of Original Medicare. Medicare Part A is hospital insurance that helps pay for medically necessary services, like hospital inpatient care, including semi-private rooms, meals, general nursing, and other hospital services and supplies. It also will help cover skilled nursing facility care that is not related to custodial or long-term care when certain conditions are met. It'll even help cover home health, hospice care, and blood needed as an inpatient. Medicare Part B covers a number of medically necessary services and supplies like doctor's services, outpatient medical and surgical services, home health care, durable medical equipment, and preventative services like exams, lab tests, screening, and shots to help prevent, find, or manage a medical problem. Part D is prescription drug coverage. While technically Part D is optional, in most cases there are penalties to not getting it. Part D can be the most complicated part of enrolling in Medicare. It involves researching plans, comparing prices, and more. MAP counselors are trained to assist beneficiaries and take the stress out of enrolling. People with limited income and resources may even be able to get extra help to help pay for their Medicare drug plan. Part D is available for all people with Medicare. You can have just Part A or both, but you must live in the plan's service area. You cannot live outside of the U.S. You cannot be incarcerated. You must enroll in the plan, and in most cases, that's by completing an application. MAP counselors can help with this. Medicare Part D is Medicare's prescription drug coverage, and the coverage is provided through prescription drug plans, Medicare Advantage plans, and other Medicare plans. Part D plans must cover a range of medications in each category: immunosuppressants, antidepressants, antipsychotics, anticonvulsants, antiretrovirals, and anti-neoplastics. You can join Medicare prescription drug plans through several ways. The first would be when you first become eligible for Medicare. That's during your initial enrollment period, which begins 3 months immediately before your first entitlement to both Medicare Part A and Part B. After you enroll in a Medicare prescription drug plan, you must remain with that plan for the rest of the calendar year. You can also enroll in a Medicare Part D plan during the annual open enrollment period. That takes place October 15th through December 7th each year. You can change your Medicare Part D plans during the annual open enrollment period, with the coverage beginning January 1st the following year. There are also some times when you can disenroll or get a special enrollment period. All of this can be covered in your Medicare New Book or provided to you with more information from MAP. Medigap, or Medicare Supplemental Insurance policies, are private health insurance that cover the policyholder. They are sold by private insurance companies to supplement the original Medicare gaps in coverage, like deductibles, coinsurance, and copayments. They pay for Medicare-covered services provided by any doctor, hospital, or provider that accepts Medicare. Medigap plans may even cover certain things that Medicare doesn't, depending on the policy. They must follow federal and state laws that protect people with Medicare. We could do an entire presentation on Medigap. Let's take a look at the next slide, which shows us what Medigap policies cover. Each Medigap policy is required to provide basic benefits. This includes the Medicare Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up, the Medicare Part B coinsurance or copayment, the first 3 pints of blood, and the Part A hospice care coinsurance or copayment. There are other Medigap policies that offer additional benefits, like skilled nursing facility coinsurance coverage, coverage for the Medicare Part A deductible, even coverage for the Medicare Part B excess charges, or foreign travel emergency care up to certain plan limits. Medicare Advantage is also called Medicare's Part C. These are health plan options approved by Medicare, run by private insurance companies, and are either an HMO or a PPO. Medicare pays an amount for each member's care, and these Advantage plans are another way to get your Medicare coverage. If you join a Medicare Advantage plan, you will have to use their network doctors or hospitals. Medicare Advantage plans are health plan options that are approved by Medicare, offered by private insurance companies that sign a contract with Medicare. They are part of the Medicare program, and Medicare pays a set amount of money to these private health plans for their members' health care. In a Medicare Advantage plan, you will have to use their doctors and hospitals, and you'll still have all the Medicare rights and protections. You'll still get your regular Medicare-covered Part A and B services, and you may even get additional benefits offered through the plan, including prescription drug coverage. Other extra benefits could include coverage for vision, hearing, or dental. Benefits and cost sharing may be different than in original Medicare, but in all plans, you usually pay deductibles, copayments, and coinsurance that vary by plan. There's a couple different times in which you can join a Medicare Advantage plan. The first is when you become eligible for Medicare during that initial enrollment period. Again, that begins 3 months immediately before your first entitlement to Medicare Part A and Part B. Or you can enroll during the annual open enrollment period. The annual open enrollment period takes place October 15th through December 7th, with the coverage beginning January 1st the following year. And if you're enrolled in a Medicare Advantage plan January 1st, you can utilize the Medicare Advantage open enrollment period, which is January 1st through March 31st each year. To enroll, you can do so by contacting the company, doing an enrollment through Medicare.gov, or contacting MAP for more assistance. This is a chart that shows some of the various costs for hospitalization and Part A services. While there typically is a $0 premium for most individuals, if you've worked between 30 to 39 working credits, you may have a monthly premium of $259. If you've worked less than 30 working credits, your monthly premium will be $471. This chart shows the general charges for Medicare Part B. The monthly premium is $148.50. If you're eligible for Medicaid or extra help, those charges may be reduced. This year, Medicare Part B has a $203 annual deductible. All new to Medicare individuals get a Welcome to Medicare visit with their doctor. It's a great way to get up to date on important screenings and shots and review your medical history. The Welcome to Medicare visit is only offered within the first 12 months of getting Medicare Part B. During the exam, the doctor will review the following: medical and social history, height, weight, body mass index, blood pressure, and a simple vision test, potential risk factors for depression, and review of functional ability and level of safety, which includes an assessment of hearing impairment, the ability to successfully perform activities of daily living, fall risk, and home safety. Individuals will get advice to help them prevent disease, improve health, and stay well. They'll also get a brief written plan, like a checklist, letting them know if any additional screenings or preventative services are needed. At this visit, the doctor may also refer for additional Medicare-covered screenings if the referral as a result of the initial Welcome to Medicare visit. There is no cost if the doctor accepts Medicare assignment, and it's a great benefit that people can take advantage of. Medicare also covers a yearly wellness visit. After you've had Part B for longer than 12 months, you can get an annual wellness visit to develop or update a prevention plan just for you. Medicare covers one annual wellness visit every 12 months. During the visit, your doctor will record your blood pressure, height, and weight, review your potential risk factors for depression, review your functional ability and level of safety, which is an assessment of the following: hearing impairment, the ability to successfully perform activities of daily living, fall risk, and home safety. Your doctor will give you advice to help you prevent disease, improve your health, and stay well. You'll get a brief written plan, like a checklist, letting you know which screenings and other preventative services you need over the next 5 to 10 years. You don't need to get the Welcome to Medicare visit before getting the annual wellness visit. However, if you choose to get the Welcome to Medicare visit, you will have to wait 12 months before you can get your first annual wellness visit. Again, you'll pay nothing for this exam if the doctor accepts assignment to Medicare. In addition to the Welcome to Medicare visit and yearly Medicare visit, Medicare covers a number of other preventative and wellness services. This slide details just a few of the wellness and preventative services covered by Medicare. Many other services are covered, such as bone mass measurement, glaucoma test, diabetes self-management training, and obesity screening and counseling. Medicare also covers some recommended adult vaccines, like the flu shot each year, the Tdap, or tetanus, diphtheria, pertussis, every 10 years, the pneumonia vaccine, shingles vaccine, the COVID-19 vaccine, and more. Always consult with your doctor or pharmacist on what vaccines are recommended for you. And there are programs available to those with limited income and resources that'll help pay Medicare costs. These programs include Medicaid, the Extra Help Program, Medicare Savings Programs, and more. If you think you might qualify or need help, call MAP. We will set up a private appointment with you and help you navigate what programs are available to you. A quick word about Medicare fraud. It is the most common scheme affecting those with Medicare, especially seniors. Medicare and Medicaid can be billed for services that you never got, equipment that you never got or was returned, or if someone uses your Medicare or Medicaid card, or if a company uses false information to mislead you into joining a Medicare plan. All of that can be Medicare fraud or abuse. MAP can assist you if you feel that you're a victim of fraud or abuse. We're here to help you. If you'd like to speak with a counselor about your specific situation, give us a call. We're currently counseling over the phone and through Zoom, but our services are confidential and unbiased, and no question is too trivial. We often deal with the very complicated as well. For more information and help, you have access to the Medicare and You Handbook, which is mailed to each household with Medicare yearly in the fall. It includes Part C and Part D plans in your area. There are other publications available on Medicare.gov, and the Medicare helpline is open 24 hours a day, including weekends. You also can reach out to MAP. Our number is 800-803-7174. We are happy to assist. Thank you so much for joining me today. Have a wonderful day.